Hi, I'm Dr. John Young, medical doctor, and this is Alex, nurse practitioner.
Hi guys. So today we want to ask Dr. Young some questions about diabetes. So Dr. Young, there's about 35% of all Americans are either diabetics or pre-diabetics. So that's a big problem. So my question is, what are we looking for? Because we know that for your primary doctors out there, you know, your doctor is saying, well, your blood sugar is too high, but it's okay because it's 116, your A1C is 4.7, it's all right. So what would you say about that?
Okay, well, first of all, I'd say there's two types of diabetes. There's type 1, where usually it happens in your youth, you know, maybe you're 10 years, 12 years old, you get a virus, it knocks out your pancreas, you can't make any insulin. And those people need to go on insulin basically from day one.
Okay.
Now, some of what we do does help that.
Okay.
But the vast majority of diabetes in the U.S. is type 2, which is insulin resistance. Think of it as this. You know, in other words, to get 1 unit of glucose into the cell, you need 1 unit of insulin to do it. But as you get more towards diabetes, you may need 10 to 20 units of insulin to do the same thing.
Wow.
And after a while, the body just kind of, pancreas says, we just can't keep going. And then the doctor says, well, here, your blood sugar goes over 126, or your A1C is 5.8, 5.9, kind of diabetic. So we're going to give you medicines. It can't be just out, you know, they say, they give you lip service, change your diet. But here, go on some pills,
Yeah.
or a lot of them are just putting them right on insulin.
Yes. And that's what I was taught in school. After a certain number, you just put the patient on insulin. What do you think about that?
Well, I think basically you're going to shorten their lives, because we know that the more insulin you use, the shorter your lifespan.
Okay.
So the first thing I do with someone that comes in, let's say they're told I have diabetes, or doing some blood work, is I'm going to get a fasting insulin on them.
So that's a blood test.
That's a blood test. Now, in the test, it says normal is like 3 to 22.
Yes.
No.
So if I have an insulin of 20, it's fine.
No, it is bad news. You want that level to be between 4 and 5.
Okay.
And most of my people with insulin levels of 20, their stomach is out to here. You can see them at the mall just walking down.
Right, yes.
Because insulin says store fat centrally.
Yes.
So what you want to do, and listen, I thank my second grade teacher, she taught me to read. Just reading the basic biochemistry and physiology books, you realize to lower insulin, you need protein. 1 gram of protein for every 2.2 pounds of body weight. I never go over 100 grams a day.
Mm-hmm.
That is not a high protein diet. That is normal. For those of you with kidney disease, that is a normal protein diet.
So, but my question is, if I have an insulin of 20, how am I going to know? Because my doctor didn't order that test.
And the Center for Disease Control said doctors need to order this. They don't. And that will tell you. And then as you increase the protein, make adjustments, food-wise, young shake-wise, you should start to see that number go down. The other way to tell is this. They will come in like, Young, it's a little embarrassing. These pants are falling off. Because as you drop insulin, you burn fat, you store muscle.
Mm-hmm. Yes.
So
yes. That's how it's done. Now, is it possible that I can have I'm pre-diabetic, I have the diagnosis of pre-diabetes, and I have low insulin? Is that possible? Or should I look into that anyway? Should I go ahead and test it anyways?
I've seen maybe 1 or 2 patients like that. That's very rare.
Okay.
I like the insulin because it may be 7 or 8, and the blood sugar is still kind of normal.
Yes.
The body's adjusting, but I'm telling him, you're going to either pay me now or pay me later. In other words, you can jump on this and diabetes never becomes part of your chart. Or you can just wait and then do it.
Because the average, I think the studies show that it can take about sometimes up to 10 years to actually show up with a diabetes diagnosis. So your purpose is really to avoid that, to get to that point.
It's a 7 to 10 year head start on diabetes.
On diabetes.
Yeah.
So we want to get catch that way before you have the diagnosis of diabetes. So that's the goal.
Right, and I've had people on insulin. One guy, 99 units of insulin a day, in 3 days he came off. Now that's the exception. But you can see that when you do change some things do happen.
So the solution, if I already have an insulin number of 20, which is high, what you're saying, so the solution is not to give myself more insulin. I don't need more insulin. I already have enough insulin in my body.
Right.
I just need the insulin to work for me.
Right, and you reset those
And
receptors.
I reset those receptors
Right.
with more protein.
And the other thing to remember is this. Many doctors are trying to get people, and give them so many drugs, to get their blood sugar to normal. There is tons of studies out there showing that when you do that, you shorten their lifespan. They're diabetic, they have a problem, and no one knows, even the government doesn't know what the insulin, correct blood sugar is for a diabetic, but it is not 65 to 99. You need to realize that. And so I have people off all their meds, and their blood sugars maybe run 110, 120, 130, and they're doing fine. Insulin levels are normal and all that. So don't let your doctors over-medicate you.
Over medication can be a big problem because we can see all kinds of side effects. Even if they're just taking, let's say, my doctor told me that I can just take metformin, which is an oral medication for diabetes.
Right.
It's not an injection of insulin, but you can have side effects with that, and you can have severe diarrhea. I've seen patients like that. That's a side effect that you don't want.
And it can be hard on the kidneys.
And it can be, diabetes is already hard on the
Right.
kidneys. We already know that.
Right.
And we're adding a drug. So the first step is to try to treat the cell so you can heal the body.